I'm Dr. Riel Hogseth, founder and director of the Pediatric Dental Team Association. So this is a tip that's going to save you time, whether it's chairside, in a surgery center, or in the OR. And we are talking about the immediate space maintainer. Now, I know it comes whether it's on a band and loop style or stainless steel crown and loop style. I urge you to use the band and loop style because it's much easier to repair if it gets broken, where you can just pop the band off and still keep full coverage with the stainless steel crown. But if it's a stainless steel crown loop, then you have to take the whole crown off and put that back on, and that costs a lot more money and is much more difficult to do, especially if you have a patient that has a behavioral issue. So let's focus on the band and loop immediate space maintainer. So what I would suggest you do is take each one of your bands, whether it's first primary, second primary, first permanent, whichever ones you routinely use as your anchor tooth for your immediate space maintainers. Take then the bands that you use, whether it's DeNovo or another company, and take each one of those crowns and fit a corresponding band to it in your hand. And then make that note down on an index card or however you want to make that note, so that all of your crowns now have a corresponding size for an immediate band and loop space maintainer. This is going to be great for you when you need to do a crown and then a band and loop immediate space maintainer. So that way you can go ahead and fit your crown, cement it, and then use the crown that you already know is the correct size. So that minimizes the on and off movement of fitting that loop portion of your band and loop, so that you're not going to loosen the adhesion that you have with the crown. So it makes it much easier to just take it on and off a couple times while you're sizing the loop portion. This is also a great tip because if it does come in and it's broken or the band is broken and you need to repair your band and loop on a patient that you've already obviously done it, it is much easier for you to already know the size of the band that you used because you made a note in your chart, correct? And then just pull that one out, resize the loop portion of it, and then cement that back on. So it's much quick and easy. You don't have to mess with it too much, which is great if you have any kind of behavior issue with the patient or just anxiety in general, or you're just fitting it in between your other patients as an emergency. So it doesn't take any time at all when it's pre-sized. This has been your Practice Pro from the PDTA, and I'll see you on the next one.